Assalamu alaikum, hello and welcome to the Health Show for a special live show looking at the coronavirus pandemic. With the recent outbreak of the disease that's become a pandemic around the world, we're bringing you this special programme to help you understand exactly what the coronavirus is and what you should do from a health perspective to avoid catching it or passing it on. We'll be welcoming health experts who will share their viewpoint and opinions on the matter too. Since it was first detected, the coronavirus, otherwise known as COVID-19, has been spreading fast in the last few months. As of today, more than 246,000 people are known to have been infected with the disease, and tragically, there have been over 10,000 deaths recorded worldwide, including 144 here in the UK. Sadly, the numbers are still rising, so it's crucial that we as a community and as a nation don't panic, but remain calm while taking all necessary precautions. The cause of the disease is suspected to have come from an animal market in China's Wuhan state. The virus can cause pneumonia-like symptoms like coughs, fever and breathing difficulties. In severe cases, there can also be organ failure. Recovery depends on the strength of the individual's immune system, and tragically many of those who have died have been the elderly who had been suffering with underlying health problems. In the UK, the medical advice from the NHS is that anyone in a household who develops a persistent cough or high temperature should stay at home for a minimum of 14 days, keeping away from other people. This applies to everyone, regardless of whether they have travelled abroad or not. Now, for more information, the best place to go is the dedicated coronavirus website, which is 111.nhs.uk/COVID-19, and you'll see that detail on the bottom of your screen, and we will give you that a lot more throughout the show. Now, if your condition worsens or your symptoms last longer than 7 days, then you should call NHS 111. Now, to talk through the various issues surrounding coronavirus, I'd like to welcome Dr Imran Gohar, who is a general practitioner, and Sidra Naeem, who is a Muslim chaplain and alima, who has also studied biotechnology. Well, first of all, thank you so much, both of you, for coming in. That's really great. Thank you.
Thank you.
Really appreciate that. Lots to cover. But first of all, as the government begins daily briefings on the coronavirus, the Chief Medical Officer says that newly introduced social distancing methods will last a minimum of weeks and maybe even months. And we heard this from our Prime Minister, Boris Johnson.
This is a brand new disease. We need to learn as we go along, and that will be part of what we do.
It looks as though we're now approaching the fast growth part of the upward curve, and without drastic action, cases could double every 5 or 6 days. In a few days' time, by this coming weekend, it will be necessary to go further and to ensure that those with the most serious health conditions are largely shielded from social contact for around 12 weeks.
This is not a situation where a couple of weeks and this virus is on the way. Absolutely not. People should be thinking of a minimum of weeks to months, and depending how it goes, it may be longer.
Get the disease under control in the way that we're describing. If we can flatten that peak and it starts eventually to decline and tails off across the world, then there's absolutely no reason why economies worldwide should not come roaring back.
So first of all, everyone watching will notice that we're observing this social distancing, keeping people apart from one another. But what I'd like to do, first of all, Doctor, if I may, is just get back to the real basics. Many people will have heard of it a lot, but I don't think it does any harm hearing it again. Sure. Tell us exactly what COVID-19 or, whatever people might want to call it, but COVID-19 seems to be the term people are using mostly now. What exactly is it?
Well, as the name says, COVID-19, it's a sort of short for coronavirus, which was found in 2019. So it's kind of a virus. In a nutshell, you can say it's like a flu type of virus, which is spread by the respiratory droplets. And it basically stays in our throat or nasal passage and it can go to our lungs as well, where it sits and cause problems. Basically, the reason why it's quite dangerous, as far as we know till now, is because we have little knowledge about it, and the rate of its transmission. It's been spread throughout the world in a very short period of time, and we know little about it as well. So that is one of the danger. We also know, as I said, a little about it, but we know for certainty that it is affecting the vulnerable people. For example, people with some long-term conditions, people who are elderly, definitely above 70. So there are certain things we know about it. Why there is more anxiety is because anything which is unknown and is spread with such in a so short period of time throughout the world will make people anxious, and the number of deaths we are seeing in a short period of time as well. The problem is that we know little, plus we don't know how to prevent ourselves. I mean, apart from washing hands and things, I mean, there is no vaccine for it. There is no treatment for it as such. So there is a lot of unknown, and anything which is unknown becomes makes people more anxious, actually.
And indeed, judging from everything we've seen so far, there is a lot of uncertainty and a lot of distress being caused by for a lot of people. And if I can just come to you, Sidra, for a second, obviously being a faith channel, people turn to the Islam channel looking to see all aspects of different areas of life, and in this particular show of health and how it affects their faith. And within the Muslim community, obviously with mosques closing, it's had a huge impact, hasn't it?
Definitely, but very quickly at the same time, I think the Muslim community are adapting as well to the situation. So although 5 times prayers you get more reward reading in congregation in the mosque, people are making little congregations within their own families. So it's actually bringing families strongly together. So we've got, the father, for example, maybe leading the prayers at home, and the whole family are behind him. Just 2 days ago, we had a sermon that was released about Friday prayers, Jummah, which is compulsory in Islam. But people said that you can actually pray that if there are 3 male people in the house, you can actually do a Jummah in your own house with a sermon and a call to prayer and everything. So I think that is at the same time relieving people a lot.
Now, there are some people who will have different ideas and different faiths and so on, and a lot of people will be coming up with all sorts of conclusions. Many people's faiths will be tested at this time, with some people even suggesting it's a punishment from God. How do you recommend that people actually keep their faith and keep it strong during this time?
I think that the way to explain it is, if it brings you closer to God and it brings you closer to the faith, then that is a good thing. And there has been so much good that has come out of this virus. Everybody's more united, everybody's looking after each other, we're all helping our parents all of a sudden, and the elderly. If it takes you away from God, any illnesses, then you can class it as a punishment according to Islam. We're also being tested as well.
And it's a really interesting aspect, hearing the positivity. It seems tough at this time to be talking about the positive things, but there are a lot of positive things that we're hearing about, of people helping each other in the community, making sure that people have supplies. And of course, we have a lot of technology to help us these days in terms of, with FaceTime, with all sorts of other applications to get that contact. But coming to some practicalities, Doctor, for a second, we hear about this self-isolation. Give us a bit more detail of what that actually means in practice, and especially for those, older members of our community.
So self-isolation is a hot topic right now, and we're getting loads of calls about it. So there are a few bits of self-isolation. For example, a patient who complains of cough without any fever or any other symptoms of coronavirus, we advise them to self-isolate for 7 days. That's NHS guideline. If somebody who comes into contact with somebody who's known to have coronavirus but don't have a symptoms of coronavirus, for example, fever, cough and other bits, then they have to self-isolate for 14 days. If somebody who's a relative who's elderly and they're looking after them. 14 days self-isolation also apply to them as well. People who are elderly, we are advising them to self-isolate in a particular place so that they don't have enough contact with the outside. For example, people who are working, going in and out. And that also applies for 14 days as well. So yeah, self-isolation is right now divided into 3. I don't know how it's going to pan out in the future, again, but at the moment that's what we're advising.
And the reason for the self-isolation being up to 14 days is because it takes so long for this disease to manifest itself. I mean, that in itself is quite unusual, isn't it? The amount of time, the incubation time of this disease is unusually high.
Yeah, basically, it's a viral cycle, which is from 7 to 14 days for any virus anyway. But so that is why they're saying, as a precautionary measure, you should be off for that period of time. Yeah, so it's as I said, it's very infective. It's little known about this virus as well. So the whole point of self-isolating is that the people, even if you are healthy and you come into contact with that, you will have immunity against this virus, hopefully. And once after 14 days, you will be immune to it as well.
And again, all of these questions are answered on that website, which we're putting on the bottom of your screens now. That is and should be the main source of information that people use, because one of the concerns of going around at the moment is the amount of chatter on social media, which frankly a lot of it is really unhelpful, isn't it?
Absolutely, and especially people who are coming out and saying all sorts of things without any evidence. We believe on evidence-based medicine, and whatever. And when you don't know about the viruses, how can you say for certainty? I think it is increasing the anxiety of people. There are certain food I'm hearing a lot about that whether it can cure it. There are certain things to do. So it's all speculative. Actually, people are just putting anything on the social media. There is no evidence behind it. And I think the way this disease is and how new it is, I think it will take a long time for us to understand it fully and come out with all these, remedies and everything else.
And we're very fortunate here, aren't we, Sidra, in the UK? We have an amazing NHS, health system here. We have probably some of the most respected doctors and medical teams in the world. This is nothing to do with politics. This is the finest medical teams in the world are working on this and giving us their advice, and they're the ones who are making sure the information on that website is up to date. Is that correct?
Yes, that's right. And they're also, if you think about it, all the medical professionals are putting their own lives at risk. That's the biggest one I think everybody needs to know about. Everybody else is all in isolation, but it's the medical professionals which are still out there working, pharmacists, doctors, nurses, all of them are putting their own lives at risk, and they're working out there for the betterment of the community.
And we should also take this opportunity to maybe put a few myths to bed as well, because there are quite a lot of myths out there. One of the ones is that people seem to think that the supply chain is going to run out and people aren't going to be able to get food and various things. We've seen some, frankly, ridiculous scenes in supermarkets and things like that. You're on the front line, you get to hear it all. My understanding is that the supply chain is absolutely fine. They just can't cope with people panic buying. But if people didn't do that, there's actually plenty for everyone.
I think as far as we are getting the news, we're getting news or emails almost every few hours actually from NHS and all updates and things. Till now, I mean, there is no shortage of food or anything else like this. Now, as I said, this is something new. So everybody is coming into action now. How we going to cope with it? Medical side is one, but social is another. Lots of, in UK there's a huge number of elderly population. Loads of them live alone. So, how are we going to deal with their health issues? It's not just coronavirus. There are patients who are suffering from cancer. There are patients with other multiple health issues, patients with other, serious conditions who are at home and who need, kind of help from the medical profession, but they can't get out of the house now. So we are thinking about alternatives. We are doing a lot more phone consultations. But as Sidra mentioned, I think the challenge is to how you do a delivery of a safe, healthcare information and help. Because the frontline staff, let's say if doctors and nurses become victim of this virus, then who's going to deal with the problem? So it's quite challenging actually at this stage to provide a safe and effective healthcare system, to run a healthcare system. But we are all learning every day, and we are trying to do things which we never used to do before. And I think the government till now is quite encouraging people if we are making sure the delivery of the safe system. The other thing which is hopefully I'm hoping will come into place is a antibody check for the people who may have coronavirus, and they are prioritizing it to the healthcare professional first so that they can be checked and see if they have immunity. There is a huge debate going on because healthcare professional faces all these cough cold on a daily basis. They may have immunity to it than the other population. And if, let's say, people who come back as a positively immune to this virus, then there's a lot of things can be learned from them as well, and they can also work more effectively and openly in the community. So yeah, there's a lot of good things in the pipeline.
So a lot of positive things as well. What I'd like to do, we've only got about sort of 6 or 7 minutes before we go to a break, and then we're going to be opening up the phone lines for you at home to give us a call and ask any of your questions. What I'd like to do is do some quick fire questions, if that's okay, to help people understand some real basics of the coronavirus and what people should and shouldn't do. So the first one is, we've heard a little bit about paracetamol, we've heard about other kind of treatments. What's your view on somebody who's self-medicating? Maybe they've got a mild case. What about the talk about paracetamol?
I think the overusage of any medication it's not advisable right now. It's totally symptomatic. Treat it as any other flu. If you take paracetamol, there's nothing contraindicated as such, but take simple paracetamol, simple gargles, steam, rest, plenty of fluids, which we advise normally for other viral illnesses as well, like common cold and cough. At this stage, I think people are using a lot of ibuprofen and anti-inflammatory medication for no reason, but there is no evidence again to show that it is effective or is going to prevent it. So I think stick to the basic right now. Keep your hands washing, keep your hygiene when you're entering into the house, when you're going to any new place. Make sure you wash the surfaces if you're going to some market or whatever outside. I think it's a basic, simple, viral advice which we normally give, rather than specific. Because again, it's an unknown virus. The advice is just symptomatic, as for any other viruses. Do not trust on you eat ginger or you eat garlic. I'm hearing all those sorts of things. Yeah.
Are there any foods which have been found to help?
Well, there is no evidence about it.
Okay, so basically, let's wash that one to one side. Next thing is children, and Sidra, I know you have a lot of experience here with children. The word is that children, if they do get it, is very, very mild symptoms, but can they still be carriers and pass it on to other people?
Yes, definitely. It's an invisible virus, so even some people actually don't have any symptoms, but they can still pass on the virus to others as well. So this is why this is quite dangerous, and this is why they had to close down the mosques and things. It wasn't just easy enough just to tell the elderly to stay away, or people who have got pre-medical conditions to stay away, because it can be hidden inside you, the virus inside anybody, and then it can get passed on to others.
And in addition to this point, actually, it's kids have a good immunity normally, and they're quite resistant for these bugs. But the danger is they're going back home, where they may have elderly grandparents, they may have some siblings, parents who got some critical illnesses and stuff. So I think that's something which we need to be aware of, that yes, kids, although they may have a better immunity for themselves, but they can still transmit it to the others.
And I think that's particularly important in the Muslim community,
yes,
isn't
definitely.
it, where families are they're normally so strong together and so on. And so if children are living with their grandparents, then what's the advice there versus, obviously, if you don't live with elderly people, it's best to just stay away for the moment to allow them to self-isolate. But what about if they're living in the same house?
They need to be distanced. that's the first thing. 2 metres, isn't it, distance at the moment that the government has given. So the children need to stay 2 metres away, really. And they can wear face masks. But the thing with the face mask is very important. It's only if you've got the virus, then that will stop it spreading to others. But if others have got the virus, that can still come to you with the face mask on.
So there's a bit of a fallacy with the face mask.
Yes.
For protection, forget it. But if you actually have the virus, you're in a home or whatever, to stop or to hopefully ease the spread, then that can actually help.
Yes.
And again, there are a lot of people who do have to go about their daily tasks. They have to go shopping. They have to, do their things. And some people, of course, are still working, not just, health workers. A lot of people are still working. What advice would you give to them in terms of protecting themselves?
Wash their hands, and wherever they're going, make sure that everybody working out, their colleagues, they don't have any symptoms of cough and flu type of things. Make sure they can wipe the surfaces and stuff where they can touch things. Make sure they wash their hands when they're moving from one room to the other. Minimize the exposure to anything which is coming externally. A point I just want to add about the children at home. Actually, one thing which is advised is if you have 70 plus grandparents or somebody living in your property, it's better if they self-isolate for 14 days actually. How they can do it, basically, they can do it even in their room. Make sure the children who are certain schools are still open today, so they're coming back home. So make sure the grandparents have no direct contact for at least 14 days to be on the safe side.
And of course, there's lots of things, practical things people can do. You hear a lot of the various sort of local shops, and people are doing deliveries and things like that where they can leave something outside. So it is, although it's not comfortable, it's not easy, it is possible to completely self-isolate, isn't it, where you literally don't have contact and therefore you can really protect yourself.
I think what people need to understand is why it's important. You have to break the cycle. This virus has a cycle. And it's like, you put the matchbox in a line and it just ignites each other. I think you have to break the cycle. And the one way of breaking the cycle is that I don't transmit it to you. And then, obviously, if you don't have it, then you will not be able to transmit to the other. So in that manner, it's not about catching the virus. The effect of viruses are the key. So let's say, if I transmit to you and you're high risk, then it can be fatal. So
Okay.
that's where you need to break the cycle, yeah.
Okay, and very, very quickly, Sidra, mental health is a massive issue here. For a lot of people who are already suffering from mental health, this will only exacerbate it potentially. And just very, very quickly, could you give us maybe some tips on how we can deal with it mentally?
I think that we need to build up our immunity. One of the problems with this disease is that because it's a new disease, we have no immunity against it. So there's a latest acronym which has come out, especially for the coronavirus, called New Start.
And actually, we're going to have to talk about that after the break, unfortunately, because I know it's a fantastic acronym and there's lots of great things in there, but we'll probably do that straight after the break. But thank you very much. And of course, we will give you an opportunity to ask our experts any questions you have as well. So do let us know that. But in the meantime, should you suffer from any medical problems or health concerns, it's always highly recommended that you contact your doctor or GP, as the Health Show gives you an alternative viewpoint to the health concern being discussed. Again, we've got lots more information for you, but in the meantime, as always, go to the coronavirus website for that key information. This is where you get the best information, and it's 111.nhs.uk/COVID-19. That's where you're going to get the accurate information about coronavirus. Remember, if you have any symptoms that worsen or symptoms lasting longer than 7 days, that's the point that you then call NHS 111. We've got lots more to talk to you about, and we're going to be opening the phone lines straight after the break as well. Join us after the break. Welcome back to the Health Show, a coronavirus special with me, Alastair Greener. Now, in this half, I'm joined by Dr Imran Gohar again, and also I'm joined by Sheikh Dr Haitham Al-Haddad. And we've been discussing so far what the virus is, where it has come from, and we've also been highlighting what we must all do to prevent contraction of the virus and also passing it on to others. This is especially important with more than 3,269 people in the UK having tested positive for the virus so far. Now, if you'd like to call in, we are now taking your calls. The calls lines are open, and the number is 0208 554 2514. That's 0208 554 2514. And feel free to call in now. In the meantime, in Mecca, the white-tiled area surrounding the Kaaba, which is usually packed with tens of thousands of pilgrims, is deserted as Saudi Arabia empties Islam's holiest site for sterilisation over fears of the coronavirus. This, of course, is an unprecedented move after the kingdom suspended the year-round Umrah pilgrimage. So let's take a look.
Saudi Arabia on Thursday emptied Islam's holiest site for sterilisation over fears of the new coronavirus, an unprecedented move after the kingdom suspended the year-round Umrah pilgrimage. State television relayed stunning images of an empty white-tiled area surrounding the Kaaba, a large black cube structure inside Mecca's Grand Mosque, which is usually packed with tens of thousands of pilgrims. The decision to suspend the Umrah comes ahead of the holy fasting month of Ramadan, starting in late April, which is a favoured period for pilgrimage. It is unclear how the coronavirus will affect the Hajj, due to start in late July.
So, Sheikh, thanks very much indeed for joining us.
Yeah.
You know, seeing scenes like that, you know, seeing Mecca empty, you know, shows how serious this is.
Yeah, this is absolutely the case, and the matter is serious, and everyone is taking it seriously. But see, there are two things for the reasons for such epidemics or such pandemic. Now, there are the physical known reasons for us, and there are the non-physical reasons. You know, we believe in God, and we know that God has control over everything, the physical and non-physical. Now, as I don't know whether it is true or not, but one of the main people in Italy have said, we have tried everything in our hands, and now it is up to the heavens. Okay, now what does that mean? Even Donald Trump have said, now it is the time for us to pray. Now, what does that mean? It means that, yes, we need to take some physical measures, but also we need to turn to God, who controls everything, and ask him to elevate and lift this calamity from, or off the entire humanity. So anyway, they have taken this measure, whatever they have done. Of course, it has been taken, but in my view, I think we need to turn to God, who controls everything, in order to help us in removing this
And
calamity.
it's a really interesting balance, because you touched on it there, didn't you, that absolutely people will be turning to their faith, and their faith will be tested at times like this.
Yeah.
But at the same time, don't rely just on your faith. You still need to follow all of the other recommendations that the health experts are making.
Agree. And in the meantime, we do not need to rely on the health measures that the health experts are saying. And the health experts, it is very unfortunate that they are always looking, or in most cases, they are looking at it from just physical health, materialistic,
Well,
medical,
from a scientific point of view.
scientific. Not necessarily scientific, because even science sometimes is unable to answer so many questions, as it is the case now. and we are not.
Okay.
Religion,
Well,
especially Islam, is not against science.
That might be something that many people will agree with you. I'm sure everyone will have their opinion. But interesting enough, that might be one of the questions that comes up. And I know we have a caller on the line at the moment. So if you could start off just by saying who you are and maybe where you're calling from today, and then let us know your question. I'm not sure if they're still there. Are you still with us?
Hi, I'm calling from London, and I have a question for the GP. I suffer from asthma and fever, and I have to take antihistamine every day during the hay fever period. Is it safe for me to take it while the coronavirus?
Okay, so if you could, we were breaking up there a little bit. So my understanding is you have asthma and you're taking some medication for that. Is that correct?
I have asthma, but I also suffer from hay fever.
From hay
and
fever?
I wanted to know, I wanted to know if it's safe to take antihistamine for the hay fever.
Okay, so is it okay to take antihistamines? Because a lot of people will be suffering from hay fever at this time.
Yeah, absolutely.
Yeah, because it might
safe.
reduce my immune system.
Yeah.
I don't
Absolutely,
know.
it's safe for you to take it. No problem.
So thank you very much indeed. That's definitely something a lot of people will be asking. We have lots and lots of you on the line at the moment, so we'll get through as many as we can. So we'll keep our answers really short if we can. So could you tell us who you are, where you're calling from?
Assalamu alaikum. What I want to ask you is that in our deen it says that if a Muslim misses out on 3 Jummas, one becomes an infidel.
Okay, what we'll do is, if you wouldn't mind just holding on to the line, because we've got loads and loads of people. So what I'm going to do is take about 3 questions, if that's okay, and then we'll answer the questions, each one afterwards. Okay, so thank you very much. So it's basically all about the prayers. Next question, please.
Right. Yes.
Yeah, could you tell us your question?
I have a question. It's a medical question. That I'm a heart patient with a couple of stents. I have self-isolated myself for nearly a week. Popped out only once in the cab. Now, I need to walk. It's affecting me staying at the home, and, it affects your mental health. Should I do that safely? We're putting gloves on, etc., and just take a long walk and come back? I mean, would it break my isolation, or what?
Okay, we will come to that question in a moment as well. Thank you very much. We'll just put those 2 questions to you. So first of all, Sheikh, you're probably the best person to talk about the prayers. A lot of people will be concerned about how they can fulfill their prayer commitments. So what is your view on that? How do they do it?
Yeah, it is a matter of concern. That's why we are recommending certain recommendations, but not to abandon the prayers in the mosques completely. For example, we are recommending that the congregation to be smaller, to apply very strict rules in terms of the age who is accessing the mosques, to bring their prayer mats, maybe to wear gloves and to put masks, and to maybe wash their hands before and after, to close the washing facilities, and to try our best. Because, see, let me link that with the second question. Because self-isolation in of itself can bring other diseases to individuals once they don't mix with others, and they might become more stressed, they might have anxiety, and actually they might internalize the illness. And doctors can speak better, in psychologists in particular, they are in a better position to speak about this. And that's why we say that God, the divine, he considers all these elements. He doesn't consider just one element, the physical element. No, he considers all of these elements, and that's why he is encouraging us to go to pray even in times of difficulties like this. In fact, in times of difficulties, he wants us to turn more to him.
Okay, I'd like to bring you in, Doctor, because obviously it's a very difficult challenge, isn't it? Getting that balancing act between wanting to fulfill your prayer commitments and also making sure that we're doing all of the things that we've been advised to do.
I'm not a faith expert, but as far as I know, Islam is quite flexible about situation, and obviously You do things on the basis of the evidence of the calamity you're facing. So I think, I'm sure Sheikh would agree with that, that there is a lot of flexibility in Islam, and this is one of few of them you mentioned, actually, what's happening in the mosque, which is quite good in preventing the virus. I just want to come back to the questions that gentleman asked.
Certainly, please.
Yeah, please, because I think that's a lot of people have that question in mind. First of all, he didn't mention the age, but I mean, if doesn't matter if what age he is, but if you are high risk and you got certain conditions, there is a self-isolation actually for 12 weeks suggested.
12 weeks?
Yes, and if you're high risk. But if but it doesn't mean that you can't go out of your house. You can go and walk in the gardens, and if, let's say, on the street or something, nobody's there, you can go and do a walk and stuff like that.
And especially if you go at off-peak times when people aren't around. So when people aren't on their way to work, on the way back from work, if you pick your timings, you're going to be better.
Let me ask
can we just
question.
finish this one just really quickly, Sheikh, because we've got a lot of calls coming in.
Because this is really very interesting.
I fully appreciate it. It's very difficult, and I know there's a huge conversation we can have it. Let's, if we can. So basically, you're saying take exercise, but do it at a time when you're going to be reduced chance of meeting other people and so on. If we can just take some more calls, if that's okay. I just want to answer as many as we possibly can. And I believe we've got a call coming in from Nigeria.
Fatima from Nigeria. I want to ask you.
Hello, you're welcome from Nigeria. What question have you got?
Or drugs that can use to prevent that coronavirus?
I'm sorry. So I think maybe she was talking about, other coverings and things like that. I'm not sure she mentioned towels and things.
So I assume she's saying how to prevent, as far as I've heard. I think prevention, we're all repeating again and again, wash your hands, make sure you don't go to public places where you're in close contact with general public. Make sure if you have any cold, cough, sneeze, stay at home, wear a mask if possible. And make a strict regime when you're going in and out of the house. Make sure you wash your hands as well. If you're going to work, make sure you have certain protocol there as well.
And reduce your contact with other people as much as you possibly can.
The mask, does it really help?
So it's not really like preventative. There's certain type of mask which they're saying, the type of mask we're using. I have doubts that they will prevent it, but at least it will, not spread the virus. So let's say somebody cough or sneeze, at least they can contain it to themselves rather than spreading to someone else.
And of course, for many people who don't know they've actually got it yet, the symptoms haven't become prominent enough. It is protecting. Okay, do we have any more calls on the line? We do. We've got about 5 or 6 of you waiting, so we'll try and get through as many as we can. So next caller, please. Hello.
I'm ringing because I've had a cough for a week now, and I rang 111 and they told me to stay at home. So I've been home for 10 days now, and I've got a slight sore throat. I don't have a temperature, so should I be concerned? I try ringing 111, but it's always engaged.
So which country are you in?
I'm in the UK.
Oh, you've called 111. Sorry, I thought you said 911. I beg your pardon. Okay, so that's a really good question. So it seems to be a persistent cough, but no fever, and she's been recommended to isolate. How much longer should she be doing this for?
Sore throat.
Yeah.
Beginnings of a sore throat.
So if you have a sore throat, self-isolation is for 7 days, and it's still not better than 14 days. But if you are asymptomatic, normally, like without fever, from start day, it's 7 days. If you have fever, then it's 14 days.
Okay, so hopefully that helps you. And again, thank you for clarifying. We have some more calls, so go ahead. Who would like to ask a question? So this is Ismail from the UK. Hello, Ismail.
Hello, hi everybody, you all right?
We're very good, thank you for calling. What would you like to know?
About the coronavirus, I heard keep washing hands every 10-15 minutes, is it right?
That's a really good question. How often should we be washing our hands? Should it be every 10 to 15 minutes?
Not necessarily. We are sitting here in the show. We're not touching anything. I don't have to stand up and go for, washing my hands. I'm self-contained. So the point is, if you move around, you touch things, do certain things, then obviously you need to wash it. Don't forget, this is a virus which is caused by touching things. the whole concept of washing hand is that when you touch certain objects, for example, I touched the table or the glass or whatever, something which other people may have touched before me, it's a risk. It's kind of a way you can catch it as well.
So in other words, we're not saying it's not prescriptive every 15 minutes. It's just when you've touched something that has the opportunity of being infected. Okay, that's great. Thank you very much. We've got another call, I think. We've only got about 5 or 6 minutes left, but we're going to get through as many more as we possibly can. So go ahead. Who's calling?
Hello, Assalamu alaikum. My name is Asim.
Hello, Asim. What would you like to ask?
I just want to ask that I am diabetic, and am I a high risk, or I come in the middle?
Okay. Would you mind telling us how old you are, sir?
I'm 65 years actually.
60. He's 64.
So you are in a high risk. Yeah.
So yes. So you are in a high risk group. So you should be isolating yourself as much as you possibly can. Thanks so much indeed for your call. Next one, please. Who's calling?
Good afternoon.
Yep.
I was wondering if you can help me. I would like to ask a question to Dr. Gohar, please. I'm nearly 70 years old, and what I'd like to ask is, first and foremost, we are finding it very difficult or impossible to find any paracetamol from our local shops, chemists, you name it. We can't get anything at all. And the second question is that we've been told to take paracetamol. Do we wait for the symptom to happen and then take a paracetamol, or just take it beforehand so symptom does not occur at all?
Okay, what we're going to do is we're just going to take one more call, if that's okay, Doctor, and then we will come to... So, good afternoon, sister. What would you like to ask?
Hello, hi.
Hi, what would you like to ask?
I like to ask is, when you go to the supermarket, and then everybody else is touching the items you're buying, you're not cleaning every item there because you don't, of course, you bring it home, you just put it away in your cupboard. So how do you sort that problem out? I mean,
okay, thank you very much. That's a very good question. And so we'll put those two to, first of all, our first call, the...
paracetamol, yes.
Yeah.
So paracetamol supply is an issue, so I can't say anything about it. It's because everybody's panicking, buying like anything else. They're also, buying loads of paracetamol. So there's no evidence to say the paracetamol is a preventative for coronavirus, okay? It's a symptomatic relief like we take otherwise for headaches, for flu and other bits and pieces.
So in other words, just take it if something happens.
So if you need
and in fact, I heard on the way in, I was listening to the news that in fact they are trying to come up with ways to get the pharmacies some paracetamol. It may be in small doses, which can be available over the counter. But again, we'll give you more news on that when you hear that. Finally, that last question we had about people touching things in supermarket, touching things, obviously we can't protect ourselves against that. So what's the best way around it?
So in life, the rule is risk reduction. What you reduce the risk which you can reduce. There are certain things which are beyond our control, unfortunately. So again, the advice is when you go outside, you wash your hands. So obviously, if you have some problem, you will be least to transmit it. And also, if you buy something from outside, when you come home, you make sure you wash your hand as well. There is some evidence that these viruses don't live for long. They live for certain hours. Some people are saying...
On hard surfaces, how long do they live?
Well, they're saying it's about 7 to 14 hours they can live. It's a rough, estimate.
Not 3 days.
Well, I haven't read anything about this right now. Again, nothing is certain. I mean, things are basically... we're hearing new things every day. But what you can do is wash your own hands, basically. And so that when you come home...
And then avoid touching your face in between
Absolutely.
times. So when you're at the supermarket, wash your hands before you go, do your shopping, don't touch your face, and then wash as soon as you get home.
Absolutely. And I think in the supermarket, they are, as far as I'm aware, they are following quite a strict regime as well. The people who are putting things in the shelves and things, they're wearing gloves.
They are wearing,
So they are trying to... So it's a risk reduction. Obviously, again, that is why we are not advising people who are high risk to go out, actually, just purely because of this issue as well, because there is still a risk.
Is it advisable to wipe anything you buy?
Well, you can do that. I mean, with the wet wipes, which are antibacterial and suggested by the
Antibacterial will be enough, or alcoholic?
The one we are getting is specifically from NHS managers stuff. They have certain criteria for that.
It's been absolutely fantastic, and I'm sorry we haven't had more time to talk. I think we could have done a 3-hour special.
Yeah, I know.
But the good news is we are going to be back again next week, so we'll be able to answer all of your questions for all of you watching. We'll be able to answer more questions. We'll take your calls. And we will have experts here on the show to help. So thank you very much indeed. But unfortunately, that is all we have time for. I'd like to thank our guests, Dr Imran Gohar, who's general practitioner, Sidra Naeem, Muslim chaplain and alima, and also for you, Sheikh, for coming on the show as well, for discussing this incredibly important topic on this coronavirus special programme. Once again, we must stress that should you suffer from any medical problems or health concerns, it's always highly recommended that you contact your doctor or GP, as the health show only gives you an alternative viewpoint to the health concern being discussed, which of course today is coronavirus. Again, for more information, go to the coronavirus website, which is 111.nhs.uk/COVID-19. And again, that number and details are on the bottom of your screen. That's where you're going to get the best and most accurate information. And remember, if you suffer from symptoms that worsen or you have symptoms that last longer than 7 days, then you should call NHS 111. Thank you very much indeed again for watching. Sorry we couldn't get through to all of your calls, but we will be back again next week. In the meantime, I really hope that you stay safe and you'll be taking all the necessary precautions to protect your health by heeding the advice of the National Health Service. Goodbye for now. Assalamu alaikum.